Hi, I'm not a doctor, but I really like wearing these lab coats. You know, they're cool, they go with anything, and they come with these really nifty Walkman-style radios. Check this out. Well, I can do that later. So, you're going to be out there getting people's heads straight about Imitrex, eh? Good for you. Actually, better for you after you've been over this material a few times. Now, we know that you're good. That's why you're on the team. But you're going to run into all sorts of defense out there, you know? So, we're going to do some practice in here. Get you used to the game plan, get you used to the opposition, so you can step up to the plate with confidence, make that end run around the opposition, the objections, slam dunk that sale. Now, we're not going to teach you how to sell. You know that already. But even in a friendly matchup, it never hurts to pay attention. Know how your opposing player thinks. Know what it's going to take to score a point or two. We'll put you into several different scenarios.
For some doctors, you have to play detective. Really track down what's bothering them. Others want more education. Some good reason to change their opinions. Now, I've got some good news and some bad news. The good news is there will be no test at the end of this presentation. The bad news is
the whole thing's a test! Got that? Yeah, but don't panic. Consider it an open book test. You already got a lot of this stuff in your head anyway, and there'll be lots of help along the way. Plus, you can go over the material as many times as you want, whenever you want. The best part is you don't have to tell anybody how you're scoring until you reach the goal you want. I mean, you're not going to tell, and I'm not going to tell. Oh, heck, I guess I might occasionally go, "Ha ha, you made a mistake!" I'm kidding. Anyway, just relax, clear your mind. Well, leave that part going as telling your respiratory system to keep working. Whoops, hang on. Yeah, looks like we got a timeout while somebody up in the skybox gets a word in here. Oh, okay. Guess the person who's supposed to be doing that is in a meeting, so I'll just take care of it myself. Now, as you already know, we are rolling out a new professional campaign along with an entirely new detail piece. Now, the purpose of this interactive CD-ROM is simply to give you an idea of the feel of the detail piece and some ways to utilize it. We also included some objections that may come up. Under the resources section, we've included some of our direct-to-consumer material, as well as a link to our website, migrainehelp.com. Most of all, we tried to have some fun and make this an interactive tool to help you get comfortable with the new promotional campaign. We sincerely appreciate your efforts in the field. And now that we're out in the field, let's put this thing into play. So, I reckon it's time to hit the trail, partner. Which way you figuring on heading? Yeah, to outsiders, the job's all sharp clothes, flashy cars, big expense accounts, and all the answers. Of course, we got a lot of things to find out before any of that stuff happens. Probably one of the first things you find out about is smokeless environments. So here you are with the big scoop on the greatest thing since unsliced bread. How do you let the doc know what's up? Take a look at your likely suspects. You'll deal with all the types sooner or later. Choose one and let's see how it goes. The doctor is in, and so are you. Come on and say the spell.
Hello, Dr. Mayberry. Good to see you again.
Always a pleasure. Good to have a break in the routine.
Thanks.
Did you get a chance for a cup of coffee?
Oh, I'm fine, thank you.
Mm-hmm. Chair comfortable? You know, I've been meaning to have that thing reupholstered, but, well, you know the routine.
Really, I'm quite comfortable. Thanks, Doctor. Does your routine include a lot of migraine headaches?
Yeah.
What I'd like to talk to you about, Doctor, are some of the complex symptoms that present with migraine headaches. We call this the migraine matrix.
Migraines? No, wait a minute. You talking about me personally or the people that come to see me? There is this one patient of mine. Oh, real nice. But one of those type A personalities. Oh, boy, give you a pain. Starts here, goes all the way.
I mean actual migraine cases, of course. The reason I ask is that recent information has shown that 1 in 10 Americans suffer from migraine headache, as young as age 12. But more than 1 in 3 of those people have never sought help for the pain.
Well, it's probably a simple matter of take 2 aspirin and call me in the morning kind of thing. You know, I remember my grandma used to get those blinding headaches. She'd be in bed 2 or 3 days with the shades drawn. We told my little brother she was really a vampire.
Well, actually, migraines can show a combination of symptoms that vary from one person to the next, even from one attack to another in the same person.
Yeah, I suppose you're right, but, you know, if I don't see him, I can't treat him.
Okay, time out. Now, this doctor's raised a good point. To use Imitrex, he's first got to spot patients who need treatment for migraines. What do you do from here? All right, score 1 for the home team. Let's take a look at that play.
It's true that patients may not come to you specifically for the treatment of migraine. They may not even know themselves that that's the problem. However, there are symptoms or combination of symptoms that you can be on the lookout for. Now, we're referring to it as the migraine matrix. Now, these include pale facial appearance, nausea and vomiting, intolerance of noise, as well as intolerance of light. Now, these are in addition to symptoms such as the unilateral or sometimes bilateral locations of severe headache, especially headache aggravated by physical activity, and headaches that last anywhere from 4 to 72 hours.
So, some clues are more obvious than others. Kind of like those huge areas of fungus outdoors we only notice as little mushrooms on the surface.
Right. Actually, only 1 in 5 migraine sufferers experience what you would easily recognize as aura symptoms, seeing flashing lights, shimmering zigzag lines, or having areas of lost visual field.
The kind that usually show up here or at the emergency clinic asking for an injection, I know. And lots of them are the type that would do anything to avoid a shot under normal circumstances.
But I think you can see that by being on the lookout for those combination symptoms, you may be able to diagnose chronic migraine more often and reduce the level of discomfort and its frequency in your patients, using Imitrex tablets as a first line for patients appropriate for triptan therapy.
Well, naturally, I want to help my patients. But I also want to be sure I'm giving them exactly what they need.
Okay, you've caught up with Dr. Frazella. This is one busy physician, so keep one eye on your detail kit and one eye on your watch. On second thought, don't do that. It'll make you look silly and you'll just get dizzy.
Well, thank you for working me into your day, Doctor. I know you're busy, so I'll try. Hello, Doctor. Good to see you again.
Good to see you as well, yes.
I wanted to follow up on some things.
No objection, Your Honor. Overruled. Overruled? Why? Because we haven't heard any. Oh, right. Well, who said this was going to be easy? There are bound to be objections. Luckily, you have information that will make it easier to overcome them. Let's go back to our doctors and see if you can anticipate our intrepid rep before he gives the answers.
You know, you've got some fine-looking charts and graphs and all, but, well, when it really comes down to cases, all these various painkillers are pretty much the same, aren't they?
Now, take another look at Imitrex, though, Doctor. Imitrex is not just a painkiller. Analgesics simply dull the pain of a true migraine, and they are both habit-forming and sedative. Imitrex is a highly specific migraine medicine that interrupts the pathophysiology of the attack. With Imitrex, you can treat the migraine itself and keep your patients both alert and active. Imitrex simply can't be compared to painkillers on the same level.
Oh, you're leaving then? Okay, we'll pick it up again next time.